Hi, I'm Dr. Anita Wang, and I just wanted to talk to you a little bit about today because I think there's fear going rampant around the nation, and I just wanted to give you a little bit of knowledge and maybe calm some of the fear that's going on about this COVID-19. And I'm not unfamiliar with the coronavirus, as I dealt with, I was the team leader for SARS back when it was in China, and I was heading into China, and the streets were quiet and still, and there was birds chirping, not unlike what was going on in Wuhan. And this is a class of zoonotic diseases from the coronavirus, which comes from when they have the wet markets and unsanitary conditions, and this transfer over from animals to humans. And the zoonotic diseases, we've seen coronaviruses, right? But this is a new strain has its name COVID-19. And what we need to do to contain it is control of transmission, and the things to keep yourself healthy and protected, that is to make sure that your hand wash is key. You want to wash thoroughly and for a long enough period of time, 15 seconds or so. The surface of your hands are quite filthy because they touch everything, and you don't want them to touch your eyes, your nose, or your mouth. You don't want to stick them in your mouth. I always tell my boys, when you're going to push a button or anything that everybody else is pushing, use the back of your knuckle, because that way you're not going to put that fingertip that you just touched and accidentally rub your eye or do something. So that's a good tip. When you sneeze, you're going to cover yourself. If somebody's coughing or sneezing around you, you definitely want to, I tend to hold my breath and walk away at least 3 feet away before I take a deep breath. You don't want to inhale whatever they're exhaling, because as we know, coronavirus is transmitted by droplets. So that means it's going to be on saliva, whatever is sprayed into the air. So if you have someone who's talking, who's spitting and things like that, you don't want to be too close to that person. And so it's not airborne, which is a good thing, because then it would be rampant everywhere. So this is still high now by the WHO because it is in many countries, but there's 130 countries that have not had a case. And you're going to get cases around, because once you've done isolation and containment, there was at the beginning, it took China for SARS to report this 83 days, and now for this virus, it took them 23 days. And when they started to do isolation and containment, quarantine people would go underground and escape and try to leave and go places, and that's how it spread, right? Because just with like Ebola, that's what happened. People, when they tried to do the quarantine, they started going underground. They didn't want people to restrict them from their movement or get to their loved ones, and it spread. So right now, containment is possible. It's been identified as being possible. The case fatality rate is more severe than flu, less severe than SARS. SARS was 10%. This is about 2%. And but it's definitely not the flu, because the flu is just transmission can't be contained. Whereas this one has been proven that it can be contained, because in the last 2 weeks, I think in China, there has been less reported cases there than around the world. So every community is going to get their first case. So the 3 C's, I think it's their first case. Then you're going to get your first, cluster of cases, which is what we had in Washington. And then you're going to get, what is the last C? Your community transmission. So community transmission, instead of it being somebody you were exposed for somebody who traveled or had been near somebody who traveled, you got it from somebody from in the community who coughed or sneezed on you. Because symptoms can be mild, that the person just thinks they have the common cold, right? And for those people, then transmission's going to be going around. But then when you have comorbidities, you have other health issues, or you're just definitely not as healthy as you can be, you are going to be more susceptible to the virus, and especially if you're a smoker or you have lung issues, that's what we're finding. So you need to, the treatment for this is oxygenation and getting ventilation right away for these people. Most of the deaths that have happened in Washington have been 70, 80 years old. They've also had comorbidities too. Also, there was a death in someone who was in their age 50 who had comorbidity illnesses. So I think there is one who is maybe in their 40s, but also with comorbidities. So, I would just be careful. You want to have basically good health is what I always tell people. You have to have good nutrition, good sleep, good rest. Do the precautions of being around. Oops, sorry for my camera. Being around people. So now at least I'm human and I'm alive here, right? By that, I'm not redoing this. So you want to take what I do for my family, and I have in my cupboards. I make sure they have vitamin D, selenium, zinc, making sure that they're healthy. But also making sure you have vitamin D, probiotics, and Immunotex is one. And if you start to come down with a cold, and I use XL. A, which is vitamin A, and the increased vitamin D, Immunotex, and the Viagris. And if you're curious about this, go to my website and you can find what is my protocol to maintain you to be healthy, and what you can use if you do get the cold or the flu as your armament to help you combat it. And if you like these little snippets that I'm giving to you, share it with your friends and family. And my goal is for you to stay healthy. And that is my tip for today. All right, have a great day and stay healthy.